Well, I hope you all are feeling relaxed and stretched out after that movement break we had. Thank you to Stephanie for leading us through that. Stephanie is an exercise therapist with Inspire Health, coming to us today from Victoria, British Columbia. In our next session, we have an opportunity to meet and hear from the next generation of ovarian cancer researchers. I would like to introduce you to Dr. Alicia Tone, who will lead this session. Alicia is a scientific advisor for Ovarian Cancer Canada, and she's also the OvCAN project manager. Alicia is driven by a desire to learn and to make a real impact on women's lives. Welcome, Alicia.
Thank you, Steph, and thank you all for joining us. So I want to thank you for joining us for our first ever session, highlighting some of the exceptional trainees in ovarian cancer research from labs and hospitals across the country. I'm joined today by an inspiring group of women who have chosen to harness their dedication, passion, and intellectual energy to improving the lives of women with and at risk of ovarian cancer. Each of these trainees has been specially nominated by Canadian scientists supported by OvCAN funds. I will first give each panelist the opportunity to introduce themselves, including a bit about their educational history and current position. First up is Sarah Neresian, who is joining us from Halifax, Nova Scotia. Sarah?
Hi, everyone. Thanks for joining live. I think there's a lot of webinars to choose from, so I'm glad that you're able to tune in. As Alicia mentioned, my name is Sarah. I use she and her pronouns. And I'm joining you from Halifax, Nova Scotia, where I'm currently doing my PhD. I'm a PhD candidate at Dalhousie University, and I've been researching ovarian cancer for quite a few years now. I started my research journey while I was an undergraduate at the University of Guelph. And there I started working with something called microRNA. I'm sure we've all heard about mRNA stuff, and this is a different type of RNA. And I was so inspired by that research, I ended up actually doing a master's degree where Noor is now at Queen's University, and you'll hear from her in a second. And during that time, I really got into ovarian cancer research, and I really found my niche topic through that research. And a lot of it was inspired by just the challenge that ovarian cancer brings. And following that, I entered medical school for about a year and a half before I realized that I was really passionate about the research, and ended up actually withdrawing from medical school to actually pursue a PhD instead. And I'm also giving a disclaimer that I am 7 months pregnant, and so I'm always out of breath, and I apologize if I sound like I am running a marathon because I feel like it. And this is the only teal that I could fit into today, so this is how I'm representing. But anyway, it's lovely to be here, and I'm humbled to be asked to join.
Thank you, Sarah. So next is Ainhoa Madariaga, joining us from Toronto, Ontario.
Hello, thanks Alicia and Ovarian Cancer Canada team for inviting me to be part of this panel. I'm really honored. So I'm a medical oncologist, and I did my initial training in Spain. I studied in the University of the Basque Country in the north of Spain near the French border, and then I did my residency in medical oncology in Madrid. Once I finished my training, I wanted to pursue a career in research, and that was a little bit more difficult in Spain. So I came to Princess Margaret in 2018, and I've been doing a clinical research fellowship in gynecology and the drug development program since then. I'm also a PhD candidate, which is being done between Spain. I have my supervisors in Spain and in Canada, and it's being done at the Autonomous University of Barcelona, and it's focused on trying to understand better and improve toxicity of patients that are on research studies that have gynecological cancers. My clinical and academic areas of interest are, of course, gynae cancers, early phase clinical trial development, and patient-reported outcome assessment.
Thank you. So next up is Cathy Matuszewska. I hope I got that right. Who is joining us from Guelph, Ontario.
Yeah, Perfect. So hi, everyone. I'm at Guelph right now. I'm in my final year of the PhD program with Dr. Jim Petrick in biomedical sciences. And I've been at Guelph for a while now. It's a great institution, previously having finished my master's in the Department of Pathobio, where my project sort of focused on designing models for studies in lung cancer, as well as manipulating viruses as gene therapy vectors for cancer. And from there, I was able to transition nicely into my current role. So my current project involves an agent called FC3-TSR, which is able to repair and normalize tumor vasculature to enhance delivery of different therapies into solid tumors. So yeah.
Thank you, Cathy. And finally, Noor Shafka from Kingston, Ontario.
Hi, everyone. My name is Noor, and I'm currently a third-year PhD student in Dr. Madariaga's lab here at Queen's University in Kingston, Ontario. I'm so privileged to be amongst these incredible women and to have been given the opportunity to speak to you guys, and I'm excited to share some of the knowledge we have to date on ovarian cancer. So originally I did my bachelor's degree in medical science at Western, and I knew research was something I wanted to give a shot at. And I ended up supervising or interviewing with several supervisors around the country. And I ended up walking into Madariaga's office, and I found that she was just a breath of fresh air in terms of her ability to empower women and make me feel like I can. So I really gave her a shot and went for it. After completing my master's, I was gonna leave and say that's enough to research, but she sucked me in and I loved it so much that I ended up converting my master's into a PhD. And the story and the project that I'm currently working on had a lot of potential to grow. So I was really keen on staying within this area and with this project particularly to wrap up my PhD. And I just want to say it's incredible how tight-knit the ovarian cancer community is, even amongst trainees. I've actually never met Sarah in person, but we've been virtually in contact for, I want to say, 2 years now. So it's very beautiful how everyone comes together when it comes to ovarian cancer research in this country.
Thank you so much. Okay, so my first question is directed to Sarah. The interactions between cancer cells and the different cells of the immune system are very complex. Figuring out ways to manipulate these interactions through different kinds of immune therapy holds much promise for treatment of individuals living with cancer. Can you tell us about your work, which focuses on a specific type of immune cell?
I would love to. And so I'll start by telling you a little bit about my immune cell of interest, which are natural killer cells, or NK cells. And these cells function a little bit different from the cells that have been focused on classically with immunotherapies. So you've all probably heard of immune checkpoint blockades. I know I tuned in to some earlier sessions and you were chatting a bit about those. And those really focus on a specific arm of the immune system known as the adaptive immune system. And I'm sure some of you have also heard a little bit about this given the current situation and pandemic, but this part of our immune system is trained to recognize certain antigens or objects that are expressed by these tumor cells. And what happens in a lot of ovarian cancers is that you end up with a mishmash of cells expressing a whole bunch of these things. And so our immunotherapies to date have really focused on teaching the immune system to recognize these things. But when you have a multitude of things to recognize, and they're not really that different from normal healthy tissue, you end up with therapies that are falling ineffective. And to me, that's not very surprising. And so my immunotherapy and my cell of interest, natural killer cells, they function a bit different. They're part of the innate immune system. And this immune system is essentially for those kind of early recognition. And NK cells are actually known as the classic anti-tumor cell. And the reason we haven't really focused on them up to this point is because they're very complex. They express a lot of different receptors and a lot of different signals that can make them activated or inhibited. But more recently, these are becoming things that we understand, and we're learning more about NK cell biology and how to kind of pick a perfect fit for an individual patient. And unlike a lot of other immunotherapies where we have to, take cells from a patient and engineer them and put them back, NK cells are actually a potential for off-the-shelf therapy, meaning that you could come in, we could test your tumor, and we could essentially prescribe NK cells without ever having to remove any component of your immune system. So I'm really excited about NK cells. They have essentially no toxic side effect profile. And that's a big motivator for me in my research, is finding treatments for ovarian cancer patients that aren't going to have the same harmful side effects. Really, I want women to be able to live their lives and do all the things that they want to do while, being treated for ovarian cancer simultaneously. So this is my passion, and this is my passion project, and it's the reason that I left medical school. So I'm very confident that hopefully we'll, see the first clinical trials using NK cells for ovarian cancer emerge in the next few years.
Thank you. That's so amazing. So Cathy, this one is for you. So you are also studying immune therapy for ovarian cancer. Can you tell us more about that?
Yeah, for sure. So my current thesis project focuses on the hallmark of solid tumors, where they're able to sprout their own vessels to fuel their nutrient demands. But since these vessels are abnormal, many scientists before me have tried to find ways to sort of break them down in hopes that the tumor would be starved without them. But as we know, tumors are incredibly resilient, and they're able to always find a way to thrive. So what excites me about my work is that rather than trying to break down these vessels, we're actually taking the opposite approach and repairing them so we can have a better conduit for therapy delivery to the tumor. And ovarian tumors are hard to reach by virtue of where they are in the body. So if we can't inject therapies directly into the tumor, at least this way we can combine current therapies with our vessel normalizing agent called FC3-TSR and have a better chance that therapies will actually reach the ovarian tumor. So we've basically shown that pre-treatment with our agent FC3-TSR enhances delivery of chemotherapy as well as oncolytic viruses. And as you mentioned, we're now working on enhancing the delivery of immunotherapies like adoptive T-cell therapy into the tumor.
Amazing. Thank you for sharing that. So Noor, an important part of finding new effective treatments for women with ovarian cancer is using the right research model. Can you tell us about your work with specialized mouse models and how they might help you discover treatments for different subpopulations of patients?
Of course I can. So if you guys were listening to Dr. Vanderheyden's talk, she was talking about that syngeneic mirroring model. So my work is purely preclinical, and we're seeing what we can do in mice and see how that can be translated. So specifically, my project looks at genotype. So in high-grade serous ovarian carcinoma, which is the most common, the current issue that we're seeing with these tumors in this cancer is that it's very heterogeneous. So in any one tumor, you'll see that there are multiple different mutations that occur in these cancer cells, meaning that for the individual who asked about treatment options for BRCA1 mutated, there's current options that help those patients. But what about the other ones? What about mutations that occur in genes like NF1 or PTEN, which are all tumor suppressor genes that sometimes fail to work effectively, causing rapid proliferation of the cells and then an inability to respond to treatment. So particularly, I'm comparing and contrasting BRCA1, which now has many treatment options available to these patients, with PTEN, which is a common tumor suppressor gene that's mutated in certain scenarios and in certain patients. And as I mentioned to Alicia when I was chatting to her about this, sometimes it's the luck of the draw, and that you get a mutation in one of these genes, and it's just your tumor will respond better or worse based on that. So in this demographic of women with PTEN mutations, can we resensitize them to therapy? And so we're looking at how we can use immunotherapy in that subpopulation of women who are already almost at a disadvantage compared to those with BRCA1 mutations, which have shown to benefit from traditional and contemporary therapies. So I think the current models that we have are finally getting more detailed, that it's not just a general ovarian cancer. It's not just a general disease that can be treated the same, but that we almost have to get down to the genotype of each patient and select for certain patients that have certain genotypes that'll benefit from either immunotherapies or resensitize them to chemotherapies.
Thank you. That is so amazing. So Ainhoa, a big focus of OvCAN is the importance of including the patient voice to improve the quality of research and ultimately clinical care. Can you tell us about some of the research you have been doing that emphasizes patient-reported outcomes?
Yeah, thank you, Alicia. So thanks for pointing this out. I think that incorporating the patient's voice is very important to have a first-hand overview of tolerability of new treatments in drug development. And it gives us a really good tool to better understand the adverse events and potentially act on them, like do some education and that kind of, and maybe start with treatments earlier to try to prevent the adverse events to get worse. And a good understanding of the toxicity can also help us to improve the patient's quality of life and to give a good dose of the treatment that they are receiving. So there are several works that I'm doing in that sense, and I'm working very closely with the National Cancer Institute on a way to measure the patient-reported outcome of toxicity. The clinicians in clinical trials, we usually use a grading of toxicity from 0 to 5, and it's called the CTCAE, Common Terminology Criteria of the Toxicity. So they have developed a tool that is called PRO, Patient-Reported Outcome CTCAE, to try to incorporate the patient's voice in the toxicity assessment. There are several things that we measure, which are the frequency, the interference of the toxicity in the patient's daily life, and also the severity of the toxicity. So we are working on several tools to try to address how the toxicity changes from the beginning to the treatment to like over time, because with some treatments, such as, for example, the PARP inhibitors, we know that the toxicity is usually worse in the initial months of treatments, and it gets better over time. And providing that kind of education to the patients on the beginning, telling them, well, the nausea is going to be bad at the beginning, but then it will get better. It helps them understand how they are going to deal with it with the drug and the drug adverse events. So incorporating these kind of tools that with the patient's voice are helping the clinicians understand better which is the tolerability and act on it. So that's one of the works that I'm doing, and I'm assessing the patient-reported outcomes of the toxicity on a phase 2 trial that is incorporating a new agent that is called adavosertib. This is a WEE1 inhibitor, and it's showing really promising results in high-grade serous ovarian cancer and serous endometrial cancer. And I'll be presenting those results in ASCO this year. And then some other work that I'm doing in terms of patient-reported outcomes is trying to see which is the impact of other procedures that we do in research studies, such as research biopsies. So a lot of trials, a lot of early stage trials incorporate more than one research biopsy, and that has an impact for our patients. And understanding better what we can do to help them and support them can help us like improve their quality of life, and also potentially be able to get more research biopsies because they tolerate them better. So we're working on that, and we've seen that there is a strong psychosocial impact on research biopsies, and those are some things that we need to work on improving in the future.
Thank you. Okay, so as a former trainee myself, I was first drawn to the ovarian cancer field due to a combination of factors, including a long-standing interest in women's health, a grandparent dying from cancer, and the fact that there was so little known about ovarian cancer biology at the time, and therefore a lot of space for scientific discovery. So I'm sure the audience is very interested in learning what drew each of you to science and medicine in general, and ovarian cancer specifically. So Cathy, how about you?
Yeah, for sure, Alicia. So as you mentioned, my story mirrors many other scientists in the field where I dealt with personal loss of family members to cancer. So both of my grandparents on my mother's side passed away from cancer, and currently I have an aunt whose laryngeal cancer actually returned after being dormant for many, many years. But outside of that, I'm also the first person in my family to go to university. And I did have a really close family member who worked as a nurse. And it was very inspiring to see sort of what she did on a daily basis for a patient and sort of learn her stories. So like Sarah, initially I went to university as an aspiring medical doctor, but life led me in the direction of research because it's really exciting to be part of sort of the search for new and better therapies that could help thousands of people in the future, even when I retire.
Thank you. So Ainhoa, what drew you to this field?
So first of all, like, I think that medical oncology is one of the most beautiful medicine specialties, not only because of the new drug development and the basic science behind it, but also like the personal contact and the strong human relationships that we're able to build with our patients. And that was like one of the reasons why I chose to be a medical oncologist. And in my case, my grandma also had ovarian cancer. She had her recurrence when I was in third year of university studying medicine. So that made me want to improve things for other patients that are in the same situation as she was at that time. And the fact that she had ovarian cancer made me want to come to Canada to do a career in research and be able to work on drug development and help other patients that are on the same situation as she was.
Thank you. Noor, how about you?
I think my reasoning really was quite different. I was really just an undergrad studying different medical science courses, but I did find myself gravitating towards reproduction and development. And the female reproductive system was probably my favorite thing to study ever, the physiology and the anatomy of it. So when I honed in on my interests, I think I ended up applying only to programs at different institutions that were specific to reproduction and development. But then I think I found purpose in my research during my master's. So it might have been, a leap of faith at first, but I was lucky enough to both in undergrad and in my master's work with some of the medical oncologists at KGH at Kingston General Hospital, and at the time Victoria Hospital in London, where I did my undergrad. And I did get to meet some of these patients, and I cannot name a single patient who was ever not high-spirited and not particularly happy, and regardless of circumstances. So that in and of itself, I think, is enough to push the people who love basic science, like us here talking to you guys today, through our research, and to push us to find the treatment options. And especially for me, I think my research is targeting a demographic of women who are not currently responding to therapies, or are at a greater disadvantage compared to others. And so this particularly motivates me through my research. And then on top of that, the love for basic science and communities like this as well.
Thank you. That's so great. And finally, Sarah.
Yeah, so I'm probably just going to be copying what other people have said, but like many of us, I had a personal history with cancer. Growing up, I watched my mom and my grandma and my aunt suffer from women's cancers, and so that's what really initiated my interest. But I'll also have to say that, I started my undergrad career in environmental sciences, and just found that I really didn't like the politics and the policy that was associated with it, and was really more interested in the biology. And then I ended up switching majors twice to do biomedical sciences because of a research project and the idea that I could make an impact in an outcome or something for cancer patients. I just thought it was really cool. And I've been, interested in solving problems and being up for challenges since I've grown up. It's just something that my parents have instilled in me as both really hardworking individuals. And so when I learned about ovarian cancer, when I learned about the challenges that existed, I thought, well, we got to do better than what's been happening. We haven't seen survival changes in the last 30 years in Canada, which to me is just really unacceptable. Not despite trying. I just think, there has to be more mental energy and some creativity put into this. And so that's what really got me interested in the first place with ovarian cancer. And since I started researching in ovarian cancer, I haven't left. And even during that year and a half that I was in medical school, my plan was to become a gynecological oncologist and work with women with ovarian cancer. And I just found that I wouldn't have the same kind of impact that I wanted to as a medical oncologist as I could as a researcher. So I'm hoping to stay in this field. I'll be in it for the long run, hopefully be hanging around for a bit. But yeah, I have to mirror what the other trainee said, and there's a lot of reasons to be motivated and excited about ovarian cancer, but the patients and the personal experiences definitely are the driving feature here for me.
Thank you. So on a day like a World Ovarian Cancer Day, obviously a big theme is hope. So Noor, how do you hope that your work will impact women living with ovarian cancer?
Well, in particular, the translatability of any basic science project and preclinical is always of like the utmost important, and we worked really to see that come into play. And so my project in particular, part one is, my PhD work, and this is studying these, responders versus non-responders based on their genotype and based on the genetic profiles that they display, and then taking these people who are not responding and characterizing them to better understand how to, help them out and how to give them options that may have not worked in the past. So that in and of itself gives me hope, because it's giving women who, are given news that they, their particular cancer is stubborn and it's more rapid progressing than others, an opportunity to, be considered for other treatment options or combinations of treatments, which previously may have not worked. But part two, we do have like our lab and my PI are part of this phase one that Dr. van der Heijden was talking about, the model characterization within Canada. And so seeing how every lab is taking, the model that they're working with for their research and characterizing it the best they can to see, is this going to work for the research questions that we're asking? How can we best recapitulate the clinical and human scenario and make it work for translatability? These are the things that give me hope, because we're really getting down to the details of how to make our work translate to the human and clinical scenario. So I think that should give hope, if nothing else.
Thank you so much. So Sarah, same question to you.
Yeah, this is a great question. I think there's so many research projects, not only my own, that give me hope in ovarian cancer, and the field is just moving in such exciting ways. But if I'm going to be totally unbiased, I think the future of ovarian cancer treatments are going to involve natural killer cells in some way, shape, or form. I just think they're a superior immune cell. I think their functionality is perfect for the type of disease. It's really a spot on kind of treatment. And I think despite what happens with, an individual project that's happening in Canada for ovarian cancer research, together as a team, I think there's so much potential. And I look around at, the peers that I have and my colleagues that are just getting into the research too. And I'm just like, okay, if anyone's going to do something, we're going to do it. As Noor mentioned, even the trainees within Canada that are researching ovarian cancer are so tight knit. And while I haven't met, Cathy, I've known Jim and his research. I've known students in that lab at the University of Guelph, and I'm sure that this will continue on, and that provides me with a lot of hope. Is just like the group of researchers that are working towards a similar goal in Canada.
I love it. So how about you, Ainhoa?
I like my hope is to be able to help patients get like good quality care and meaningful treatment options. And with my work in the drug development team, our ultimate goal is like two things, like improve patient survival and improve their quality of life. And we need to continue working on finding treatments that can achieve both things, like give patients a good life and make them live longer. So that's our goal with the new treatment developments. Yeah.
Thank you. And finally, Cathy.
Yeah, so my answer mirrors a lot of the other speakers, especially Noor's. So currently I do a lot of basic science research with cell and animal models, but as I meet patients throughout my university career, I guess, and I hear about their challenges, I'm hoping that my work will eventually lead to a clinical trial. And we're definitely heading in that way with my current vascular normalizing treatment called FC3-TSR that we're working on. It would be amazing to see the treatment being combined with other approved therapies to make those therapies more efficient. So not only that, but currently ovarian cancer treatment relies heavily on chemotherapy that needs to be dosed at increased concentrations in order to achieve an effective dose, which you can imagine makes patients sick. So if we can combine chemo with the current vascular normalizing treatment I'm working on, I'm hoping that we could dose less chemotherapy because more of it will reach the tumor better. And as a result, improved delivery would lead to not only better treatment strategies for patients, but also less side effects for women undergoing treatment.
Thank you so much. So we actually have a lot of time for questions, which I think is great. But before we get to that, and I'll ask Steph if there's any questions from the audience. So before we get to questions, I just want to give a sincere thank you to each of our panelists for generously donating your time today. I know that I'm very inspired by all of you, and I can't wait to see what you all accomplish in your careers as they progress. I also hope that we have inspired you in the audience as well, as it's clear that the future of ovarian cancer research is in great hands. So firstly, I guess I will see from Steph if there's a question from the audience.
Thanks, Alicia. I see I don't have any questions, but what I did do during that is I copied over, so excuse me, I'll be reading off my sheet here. I copied over some comments from the section and I just wanted to share them. This Meet the Next Generation of Researchers session is over the top. What a great addition to hear from these young, smart women and their work in ovarian cancer. As a mom of two recent smart daughter university grads, sending mom shout outs to all of these smart young women. I thank you all for doing what you're doing. Hearing all of this gives me such hope. Thank you all for pushing the fight forward against ovarian cancer. I'm showing these kick-ass women to my kids, especially my daughter. Talk about role models. Finally, we are in excellent hands with these young, well-spoken researchers. So thank you all so much for participating today. Obviously, you can hear that this was a very inspiring session for everyone who was listening today. Myself as well, it's so inspiring to hear from you, and your obvious passion and excitement shows through. So thank you for doing what you're doing today and also for sharing your Saturday with us. So our next session, we have a few minutes until our next session starts, so you can have a quick break. For the next session, you can click on the link to the left, and that session is titled The Initial Findings from the Every Woman Study Canadian Edition. So I just wanted to say a quick reminder that this presentation is only on the initial findings, so we won't have a question and answer period after this, but we will, however, be doing a more fulsome presentation on this study in the fall, so we'll definitely leave lots of time for questions then. So thank you, and we'll see you shortly.